Hello and welcome to my channel Regenerate. Thanks for being here. I started this channel as a new mom trying to figure out how to balance my new life and working through the mind shift that happens when going through this rebirth when becoming a mother. And there's a lot of soul searching and learning, and one of the things that was really difficult for me is around healthcare and becoming a health advocate for my daughter. And I talked about that in another video. So if you're interested in that, you can check out that other video. Today, I wanted to touch on a related topic, which is vaccines. This is a highly debated topic in our society, and there are a lot of fears around vaccination. For me, my ultimate goal is to avoid needing the healthcare system, avoid any serious illness, and avoid the need for hospitalization, avoid the need for any drugs or therapies, and to do that by treating my body well, eating healthy, getting exercise, so that I can avoid the need for medical interventions as much as possible. When my daughter was born, and even when I was pregnant with her, I was very scared of having medical intervention and really was very anxious about having to make medical decisions like what vaccines am I going to give my daughter. And I did research in this area to try and give myself the knowledge to know what path to take, or to be able to choose and make that decision with supporting information. For the early childhood vaccines, which are things like MMR and varicella and hepatitis, those vaccines are ones that protect against illnesses that are serious illnesses that can lead to hospitalization for the child or for family members who are at risk that may be exposed should that child get sick from that illness. These decisions don't stop in that first 6 months or first year. They continue throughout childhood and into early adulthood. And there's always these new opportunities for new vaccines that are coming out, like COVID, and flu isn't new, but it's a new flu vaccine every year, and HPV, and all of these new vaccines that are coming out. And I saw another YouTuber who talks about motherhood things, and I really like her videos and her approach. She is very thoughtful about things and reasonable, and likes to read a lot and provide support for the things that she is presenting. And I saw her on one of her videos talk about vaccines. So I was really interested in what she had to say and where this was coming from. And she presented her thoughts, and she supported it with a book that she had read, which I picked up because I was interested. And the book is called Vax Facts. And there's another book by the same author that is called The Vaccine Friendly Plan. And I, being someone who wants to avoid the medical system and avoid any unnecessary interventions, including vaccines, I was interested in reading the book. So I picked up the book and I have been reading it. And I can see why people, when reading this, would be really afraid to put a vaccine into their child. And after reading some of the things in the book, I looked, and there's journal articles that are referenced. So I went to those original journal articles and read some of those journal articles. I also supplemented that with other journal articles. A couple of the things that I read in the book that I thought were interesting were in this anecdotal evidence of this doctor's practice. There were more sicknesses like skin rashes and runny noses and that sort of thing in children who received vaccines versus those who didn't receive vaccines. And also that people who had more doses of COVID vaccine were more likely to present with COVID or COVID-like symptoms at a later date. I think that is all helpful information for people to understand that these sicknesses might occur. What was left out of the book compared to what I was reading in journal articles is that the severity of these sicknesses and for example, somebody getting COVID after having the COVID vaccine is much less than if they were not vaccinated. So if somebody is vaccinated against measles versus not vaccinated against measles, their chances of having a very serious health critical condition is going to be much worse if they are unvaccinated. I went and read more detail on that information. And through that process, what I very quickly realized with this book is that it is only presenting one side of the story. And it talks about informed consent. And I think informed consent is extremely important, that people should understand what they are putting into their body, putting into the bodies of their children, and understanding both the risks and the benefits of those interventions or those decisions. And from reading this book, I'm seeing that only the risks are being highlighted and the benefits are being left out. In my research, what I found was that vaccines have more benefits than they have risks. This, not as a total blanket statement, because it depends on the vaccine, it depends on the individual and their circumstances. But based on that information, I decided to vaccinate my child against those early childhood diseases. And the vaccines can help prevent that life-threatening illness. And to me, that benefit of being able to protect my child from an illness like the measles outweighs the potential risks of getting the vaccine. And that's coming from me, knowing that I've never had a serious reaction to a vaccine, and no one in my family has had a life-threatening reaction to a vaccine. We've all had, aches and pains and bruised or sore arms, but to me, that is worth it in order to protect from hospitalization and to stay away from the need for medical care from these serious illnesses. And some other vaccines, like varicella for chickenpox, may not present very seriously in the child, but I'm also thinking about the health of my family and those that are caring for my child. And for someone who is pregnant getting the chickenpox can be very serious for a developing fetus, and chickenpox can also be very serious in the elderly if they no longer have antibodies against chickenpox. There are people who cannot get vaccinated because they have a serious allergic reaction to one of the ingredients, for example. If I had a child that was unable to be vaccinated, I would really have so much gratitude for other people in my family getting vaccinated or people in the community getting vaccinated to prevent the spread of these serious illnesses. So, aside from vaccinations, I think that vaccinations are an important part of preventing these serious illnesses. A lot of the illnesses that we have in our society, especially in the United States, are illnesses around obesity and diabetes and cardiovascular disease that come from not focusing on our health from a fundamentals level. And I think that it's important to prioritize our health in things like eating healthy whole foods, getting exercise daily, doing whatever we need to do to reduce our stress, whether that's spending time outdoors, going for a walk, or doing yoga, or meditating, or whatever, fills you up per se and relaxes you and reduces stress. We need more of that in our society to be healthy as individuals, as families, as communities, to support each other in our health. And I think it's so important to focus on things like good agricultural techniques and caring for the environment, for the animals and the plants that are producing food for us, and doing that in the healthiest way possible. And I think that, medical care, I want it to be the last resource. I do support scientific research and medical research and making things like vaccines and cancer therapies and diabetes therapies and these therapies that are needed. I support research on these and ensuring the safety and the availability of these for people that need them. And I think that we need to hold manufacturers accountable for the safety of these therapies for things like vaccines. We see that despite vaccines having a lot of benefit, they do have risks. And can we make those better over time? Let's hold these companies accountable, and doing so with authorities like the FDA that help to ensure the safety. And part of the process, it needs to be involvement with patient advocacy organizations that really put patient safety first, so that we can continue to have scientific improvements, so that when inevitably we do need some medical care, as I have personally experienced in my life, multiple scenarios where I have had serious life-threatening injuries that needed medical care, that I was able to have access to those and have my life saved by modern medicine. So let's start with the foundation and keep ourselves healthy as a community, as a society. And for the insurance, let's put effort and funding and support behind innovators and researchers that really have patient needs in their focus and are working to develop better options for the future. There's a lot more that could be said about this topic of vaccines and the medical system and manufacturers of medical therapies and the need for improvement in those areas and opportunities to do better as a community. And as a mother with a young child, this has just become even more important to me, and that is why I wanted to talk about this difficult topic that I know can be controversial, but I think that being welcoming of information and being united as a community is important for our health and the health of our children. And that is why I wanted to share my thoughts on vaccines today. So I hope that this was helpful to you. I would be happy to discuss in more detail anything that you may have questions on or thoughts on. I appreciate you watching, and I hope that you will join me again soon.